Welcome to our next video in our spinal hygiene series. And in this video, we're going to be talking about our cervical spine or our neck. Now, a couple of things before we get into it again is if you have any pain, numbness, tingling, irritation, we want to stop that right away. We want to make absolutely sure that your stretches are both productive, helpful, and safe. All right, so the first stretch that we're going to do is with the neck, and it's going to be rotation. All right, we want to rotate our head as far as we can to one side and then the other. Okay, now as we do that, each time we rotate, we want to hold for a 10 count, a slow 10 count, 1, 2, 3, etc. The second thing is we want to rotate and just rotate. Sometimes people start to bend, tuck their ear, and get down in this position. That jams the joints. So you absolutely do not want to do that. So just a nice rotation, count to 10 on the slow count. We're not going to do that right now to save time. Always do both sides. Now sometimes I've had patients come in and they're like, okay, do a rotation, but then you see them move their body. I say, Mary, how long have you been restricted your neck? They don't even know it because they're starting to compensate with their low back. So these stretches are going to be really super helpful, both with if you have any neck pain, injury, or if you're just wanting to keep your body moving properly. So just to repeat, right there, rotate, keep your head straight, always do both sides, and a slow 10 count. Now the next stretch we're going to do is called a lateral bend, and that is going to be the ear towards the shoulder. Again, always do both sides. And on this one, it's very important that, again, we don't feel any burning, numbness, or tingling on the other side. So, nice lateral bend, ear to shoulder. You're going to feel a nice pull over here, a nice stretch. Again, always do both sides. Do the slow 10 count. And we'll be working our way up to 30 over time as our body progresses and we begin to have more flexibility in the areas that we are stretching. The last one is going to be a flexion and an extension movement. But before you do that, I want you to have a chair next to you or something that's sturdy that you can grab onto, because sometimes these motions here can throw people off a little bit, and I want to make sure that you don't lose your balance. So with that being said, the first one is going to be tuck the chin down towards the floor all the way. Again, hold for the slow 10 count, and then up all the way back for a slow 10 count. Now sometimes my patients will start to turn their head when they're doing the extension movement, and that is because they're having pain on the other side. If you have any discomfort when you're doing this, or you know anybody who is, make sure you get in and let us check that out, because oftentimes if we have subluxation, irritation, misalignment, etc., that can be causing that. So we want to just have a nice extension, hold, and then lastly again, chin down and hold. Now, I said we're going to work our way up to 30. Over time, when you can hold that for the slow 10 count, then we're going to grow to the 20 count. And then eventually, when it's no problem, you're going to be going, yes, I'm feeling it. This is much better. My spinal hygiene is better. My mobility is better. So those are the three main stretches for the cervical spine that we had just talked about, or the neck. And again, thank you for watching our video series, and I will look to see you in the next one.